So now in this tutorial, we are going to see the management of the venous obstruction and the venous ulcer. For the management of the venous obstruction and the venous ulcer, you need to know that what? You first start with the management of the venous obstruction. Is it clear? When there is a venous obstruction, the simple management that you have to do is to improve the venous flow. Is it clear? You have to improve the principle of management. So to manage the venous obstruction, you have to improve the venous flow. Is it clear? And you have to prevent the backflow of the veins. So that's why the general measures that you have to use in order to improve it. The first thing is that you have compression stockings. Is it clear? You have compression stockings, and the compression stockings are the one that are going to improve the venous flow and to prevent the venous backflow. Is it clear? You have compression stockings. That's the first one. You have elevation of the legs when the patient is lying down. Elevation of the legs. So that is just by general measures. Now, pharmacological measures that can help you to improve the venous flow and prevent the backflow is going to be by using certain medications like Daflon. Daflon is the brand name, and that Daflon contains diosmin and hesperidine. It contains diosmin and hesperidine. Those are the two major products, and that increases the venous tone to improve the blood flow. Are you understanding? So those are this one is not more general measure, but it's more of a pharmacological measure. Is it clear? It can help you to improve the venous flow. Now, the next thing after the venous obstruction is the etiology. Is it clear? So if the etiology is a primary, when you have a primary venous insufficiency, when it is a valvular defect, the management is surgical. Is it clear? The management is surgical. When you have a primary venous defect, you have to do a surgical management. The surgical management can either be one, it can be a stripping of the saphenous vein, meaning that you completely remove the saphenous vein. Is it clear? It's a stripping of the saphenous vein. The second one, after stripping of the saphenous vein, you can have ligation of the saphenous vein and the tributaries. Either you can strip by all removing the saphenous vein, or you can ligate the saphenous vein. Is it clear? And this management, surgical management, are only used in primary venous insufficiency. Never you do this surgical management in patient that has secondary venous insufficiency. Are you understanding? Because why? You need to know that when you remove the saphenous vein, you remove the saphenous vein here, or you occlude the saphenous vein just because you have a patient that the saphenous vein is incompetent. Is it clear? In the case of a secondary case of venous disorder, there the saphenous vein is not incompetent. You have instead a thrombus at the level of the deep venous thrombosis. You may have a patient there with a varicose vein just because of the thrombus, and then if you go and remove the saphenous vein, you are going to increase the venous hypertension, and you're even going to increase the venous ulcer, because in that, when there was that thrombus, the saphenous vein was there to relieve the backflow of blood into the systemic circulation, but you went there and removed the saphenous vein, and then you are occluding again the backflow of blood. Is it clear? So this is never used in secondary venous insufficiency. The third one now is secondary venous insufficiency. Now for the cause, we have now deep venous thrombosis or all the thrombosis. In this case now, you have to use pharmacological methods. Is it clear? Particularly antithrombotics. The antithrombotics can be fibrinolytics like the alteplase or tissue plasminogen activator or streptokinase. It can be the cases of anticoagulants like heparins, anti-vitamin K, or we have oral anticoagulants. We have antiplatelets. Is it clear? So those are the three major antithrombotics. The first antithrombotic is fibrinolytic. Second antithrombotic is anticoagulant, and the anticoagulant is divided into three. The first anticoagulant is the heparin. Second anticoagulant are the anti-vitamin K, example the warfarins and the coumadins. And the third anticoagulant, the oral anticoagulants such as the rivaroxaban. And then the next antithrombotic, the third antithrombotic is antiplatelets. So those are the different antithrombotic that you have to use when you have a secondary venous insufficiency. But if the secondary insufficiency is due to a malignancy, you have to find a way now to treat the malignancy that occlude the inferior vena cava. Now, after that, after visualizing that on the secondary venous insufficiency, you need now to understand now the next point, is it clear, which is for the complication. So for the complication, you need to manage an ulcer, is it clear, the arterial ulcer. And I've already told you, every time you want to manage ulcer, the management of ulcer is divided into two. The first one is debridement. Debridement is by removing the necrotic tissue in order to promote the wound healing. And then the second element is wound dressing. And I've already done a tutorial on debridement and wound dressing that you have to visualize all the different elements for you to understand how to manage best a wound, or in this case is a venous ulcer. Now, after managing now that, we now need to pass now to the next element, which is the follow-up.